Great. Dr. Taswai, what next?
Thank you. Thank you very much again. So, Dr. Mulugeta Simon here as a guest who will speak for 5 minutes about, personal testimonial. Is Mulugeta there?
Hi, I'm here. Thank you everyone for attending and everyone who participated. The speakers were amazing, and hopefully we'll continue this. But one of the things that we've been stressing when we're talking about this meeting is really to try and find the problems from the sources, meaning what do Ethiopians and what are the real problems in the ground. So we've been trying to find people to give us testimonies. Next time we'll have more. But today we have Dr. Nahom and Dr. Gannat from Alert Hospital. They both have experience with trauma, especially related to the war right now in Ethiopia. So I will invite Dr. Nahom to say a few things. Before that, for those of you who don't know me, I live in New York. I'm a neuroscientist. I work at Columbia, and hopefully we'll meet again in other circumstances. But Dr. Nahom, feel free to tell us about what are the major problems in Ethiopia about mental health. Dr. Gannat was actually telling me earlier that, the problem is really, mental health is really frowned upon, and there's no organized, solution for any of the problems. So go ahead, Dr. Nahom.
Okay, thank you, everyone. It's really a pleasure to join this session, and I can say I learned a lot in the last 1 hour. I wish I had this experience a year back. So to say about a few things about my job, I currently work at Ministry of Health, mainly coordinating the National Disaster Response team. So it's under the Emergency and Critical Care Directorate. So as you know, in the last 1 year, like significantly, and in the last 4 or 5 years also, we have been deploying individuals to different parts of the country to respond for disasters. So in the last 3-4 months also, I have first-hand experience. I've been deployed in the northern part, starting from Debre Birhan up to the Kobo area, joining the military medical team, and also in hospitals providing primary care. So I have witnessed there is a significant, I can say there is a significant need for psychosocial support, and the area is, as you can imagine, it needs support. So when I say this, it's not only about the patients. The healthcare professionals are also one of the they are also one of the victims, I can say. So there is one experience that really touched me, so I want to share that. If you guys, I believe only you know in detail the situations, what was happening in the last 6 months. So I remember there was one big hospital in the around Wallo area. So they have been providing medical service for the military, for the casualties. There was an unimaginable number of load. The patient loss was significant. So they were treating, but finally, even that hospital became under security threat. So they were forced to be evacuated, and they were living, the professionals were also displaced, so they were living in Addis and in other safe places. So we were assigned, we were the first individuals to arrive to that hospital, and we were tasked to initiate the service immediately. So our main task was focusing on reinitiating the medical service in that area, and there was also active conflict in nearby. So there were active casualty victims coming to that hospital. So we expected the health professionals to get back to their working place immediately. So we on the next, like after the city was liberated, in the next 3, 4, 5 days, we were expecting professionals to get back. So we see professionals coming to the compound, but they are not engaged in their activity. So the only active health professional working was the team from Addis and the military team. So we were like in doubt, what's going on, what's happening. So we tried to talk to them. So some of them were saying that they need this time to they need time, so they are not ready to come back. So finally, I start to communicate after 3, 4 days. It start to cause attention in higher level also. So everyone is saying, why are not they coming back? So we are going to take measures. So we are going to write a letter. So finally, we start to communicate with health professionals one-to-one. Then we start to notice that they are also, we can say they are also a victim, like they are a patient, they have a traumatic experience related to their facility. Their evacuation was not safe. They were part of the community. So they spent 2, 3 months as a displaced, as a regular citizen out of their working place. So we start to think, so besides taking administrative measures or discussions, so we may need some kind of debriefing at different levels. So we start to do that. Then we have seen some improvements, like just having a discussion, even if we don't have any background on like doing psychosocial supports, but it was really helpful. So that was the moment I start to notice, saying, oh, okay, so it's not only the community. Usually we neglect the healthcare professionals. We think they know about how to treat themselves, but that's not the reality on ground. So that's one of the aspects. The other thing is, as you know, following the conflict, we have the military active young individuals becoming disabled, with sustaining disabilities, living in different rehabilitation centers. So we have been receiving reports that now they are experiencing some PTSD-like symptoms. So there's also a gap in that area. This gender-based violence rate, as the media was also indicated, that there are unimaginable number of victims. So those also needs an attention. So as a primary, working as a disaster response team coordinator, I have noticed like lots of gaps in areas where the professionals lack knowledge how to identify the problem in the community, even identifying it's a psychosocial problem to be treated even in themselves. So that's what I want to say. So we are working to strengthen the system, the responding individuals to have the knowledge and how to respond. So we look forward to work with you guys. Where previously it was known as Disaster Medical Assistant Team, DMAT. It was established 4 years back. Currently, we are working with other organizations like WHO on strengthening this team, becoming self-sufficient and multidisciplinary and ready to respond on all aspects. So we look forward to work with you guys also. So that's what I want to say. Thank you very much for your time.
Thank you for that very, very clear explanation of what the ground problems are. Dr. Marsha, Dr. Tasfai, continue.
All right. Thank you. Thank you so much, Dr. Nahum. It's very, very powerful and, personal experience on this big issue we are facing.
I just pasted my email on the chat, so we need a lot of information from the local people, what the problems are. Dr. Jonas, Dr. Tasfai, Dr. Udina, and I, and others in the group are thinking about writing papers, really bringing the problems out. So we will do that. Please just keep contacting us. There's someone here in this group who I will invite for like 2-3 minutes to give us an insight again about the local problems. This will be Dr. Gannat Kafle. She is an emergency and critical care medicine specialist at Alert Center. She's also the emergency and ICU director. Dr. Gannat, tell us.
So before that, sorry, Mulugeta, before that, is there any discussion for Professor Jonas before we move to different directions? So is there anything anyone want to bring at this time? Or we'll have a chance to discuss after Dr. Aida talk. Okay, continue, Dr. Mulugeta.
Dr. Gannat, go ahead if you're ready.
Okay.
Good afternoon, everybody. Thank you for the nice introduction, Mulugeta. So, as earlier, my name is Gannat. I'm an emergency physician.
Can you speak louder? Sound is not clear.
Okay, can you hear me now?
Much better, thank you.
Okay, thank you. Good afternoon, everybody. Thank you for the timely and nice presentations. They are timely indeed. So as earlier, as Nahum mentioned, we have had repeated incidents concerning how mental health is affecting our physicians who've been deployed and have come back from conflict areas. And as a hospital, Alert Hospital is taking it a little bit seriously, I think. We've had different talks on the situation, and we're starting our rehabilitation, both psychosocial rehabilitation and also the physical rehabilitation. But I just wanted to say a little bit about the AMT initiative. Previously, when we were deploying our team, the team is given all the necessary equipments needed to treat the physical traumas that they could find in the conflict areas. But the psychosocial component was completely overlooked, and many of them go to the areas and they come back. They're not that equipped to treat any psychosocial traumas they find there or they incur in the in the conflict areas. And currently, the MT team or the Emergency Medical Team Initiative, which is the MOH initiative, is as the name indicates, an emergency medical team that is preparing itself pre-disaster, during disaster, and post-disaster, and is also giving both the treatment and the psychosocial support as we talk. Currently, we are on the አሁን ያለንበት ሁኔታ ያው ዶክመንት ፕሬፕ እና ትሬኒንግ ማኑዋል ፕሬፕ ማድረጉ ላይ ነው እና as Dr. Nahum earlier mentioned ብዙ ቦታዎች ላይ we need expert opinion እና expert help የምንልባቸው ኤሪያዎች አሉ starting from እነዚህ ስትራክቸር ማድረጉ ሆት ኮልድ ዲብሪፍ እንዴት እንሰጣለን ስፔሻሊ የኛ ፎከስ የሆነው ደግሞ የፊዚሻን ኮምፖነንቱ ላይ ነው like our physicians are not trained to cope with even ኢሞሽናቸውን ኔም ማድረግ አይችሉም like አይደለም ትራውማ አለ ብሎ ዊትነስ አድርጎ እንትን ብሎ ለመናገር ይቅርና they don't even know what emotions they're feeling እና በጣም ፎከስ አድርገን ፊዚሻን ላይ መስራት እንፈልጋለን እና ቴንክ ዩ በጣም አሪፍ ዲስከሽን ነበር እና ታይምሊ ነው it's well needed እና I just wanted to say that. Thank you very much.
Myself, thank you so much, Dr. Gannat. Thank you for your service. I think this is, as you said, it's a very good discussion, and obviously we have Professor Jonas and others to follow on this and discuss with you and others. So if there is no any,
so
go ahead.
I agree really, Dr. Nahom and Dr. Gannat. They're on the ground doing the work, really. So we will be happy to be supportive and be part of their efforts, you know, to help them implement the vision they have. I think the Alliance for Research, Innovation and Education, Professor Tesfaye and his colleagues' team, is very practical. It is really focused on science. So it's we stay away from politics. So I think we're really eager and willing to collaborate in the way you want us to. Thank you.
Very good. Thank you so much again, Professor Jonas, for the comments. I think if there's no further discussion on this, we move to our next speaker.